Okay, quick video. Say hello.
Hello.
Say what's up.
My gosh.
I got the crew in tow over here. So real quick, had a patient come in yesterday. Said, actually she came to our workshop. We did Monday night. I did a workshop for a company called Keller Williams. It's a real estate company. So there was like 20 people. It was great. It was awesome. And she came in yesterday, and this lady really didn't have pain. She didn't really come in with too much pain. And we get a lot of people that come in without pain. Okay, so real quick, so I was explaining this to a patient yesterday. So when this concept of what's called nociception, okay, and this is what jams us up, because this is what trips us up and confuses us with our health, right? Because most of us grew up, well, if I feel good, then I'm healthy, right? But are we being affected from things we can feel right away? No, the number one killer, or the top killers, are like heart disease and cancer, which you do not feel right away. You know what I mean? So it's not the loud killers, it's the silent killers. But you can have a lot of health issues. You can have many things going on with you that are wrong and you don't feel it because of this concept of what this word called nociception. Nociception detects tissue damage, okay? So it's the detection, it's like a tongue twister. It's the detection and transmission of information regarding tissue stress, damage, and inflammation. And that could be happening in your spine in a condition we call subluxation. So when someone's spine is stuck and locked up, or what we call subluxated, you don't necessarily feel it, but it's sending bad information. And this is what I was explaining at the workshop. It's sending negative nociceptive information up to the brain through what's called the spinal thalamic tract. Okay, I know that's like a mouthful, but that goes up and then affects so it affects the thalamus, then the hypothalamus, which affects your hormones. So you might not have pain, okay, but this condition can be just hitting your brain with bad information and it affects your hormones. Well, what might that look like for you? And this is why these two dudes right here get adjusted weekly. They've been adjusted since they're 15 seconds old. But what that looks like in a baby, okay, if they have subluxation, it could be colic, croup, constipation, ear infections, reflux. We're gonna go in a second, but I know I'm stopping their walk. But with an adult, they might have emotional issues, even a kid, right? Where they might feel like a depressed state. When hormones are out of balance, you might have problems sleeping, staying asleep, or getting to sleep. You might have cravings, because remember, when you're in sympathetic fight or flight, because these negative nociceptive signals go into your brain, it causes a release in stress hormones in your body, and it puts you into what's called sympathetic fight or flight. So one of the staple workshops, one of the foundational workshops that I do is on stress and inflammation. I do that every month, and I do another one on what's called the Vital Shift, which is all about spine, nervous system, how to get the fastest results in our office. But a lot of times in the public, I'll do this talk on stress and inflammation. And I tie in the fact that the structure of your spine affects the function of your brain. Okay, because if you're stuck in fight or flight, you can have issues with sleep. Maybe you have reflux. Maybe you just feel tired and lethargic, right? Maybe you have cravings, right? You're having cravings. Maybe you're putting weight on and you're trying to do the right thing, you know, with your lifestyle. This is a lot of people coming up to me after the workshop. A lot of them want to come in to get checked out for subluxation. 1 second, buddy. You done with that? All right, give it to me. Sorry. Okay, cool. So 1 second, let me just finish the video. So what might happen is you might be having other issues, okay? And maybe you went to another provider to get checked out and they want to give you medications to kind of mask what's going on. But what we tell people is, listen, if your spine's locked up and stuck and we get that moving properly, it sends positive, proprioceptive, good information to your brain, to your cerebellum. And it affects the vagus nerve. So when patients come in, one of the most common things we'll hear from people, a few of the most common things is, hey, you know what? I feel like I'm breathing better. I can take deeper breaths. I'm sleeping better. Is that possible? I have less reflux. I feel more rested. I feel like I have more energy. I feel like, you know what? These cravings are going away. I actually run a fat burning program in our office. And just based on the, over 11 years of doing it, what the research shows just from our office is women lose about 3 more pounds on the program when they're under care with chiropractic care getting adjusted. What was really cool is the person who put the workshop together on Monday night was saying, hey, I've had all these benefits from getting adjusted. Can you touch on these things? Which was really awesome because she experienced a lot of positive things. And I said, and guys, we have it easier. So with the fat burning program, they lose like 5 more pounds. But why is that? It's because we're helping get you out of fight or flight. Because when you're stuck in fight or flight, remember, it's not about health and healing and resting and digesting and good things. It's about survival, which is a good thing in the short run, but it kills you if you stay stuck in fight or flight. So what I explained to the group on Monday was, listen, we do testing that's not based on pain and symptoms. So we do motion study x-rays. So basically we stand you up against gravity and we can see if you have a curve in your neck or not, because from the side you should have a curve. And then we also do these digital motion studies and we can see objectively if you have these subluxations or these stuck joints, not based on pain. And the best explanation is kind of like you woke up today and you didn't say, well, yeah, my cholesterol feels a little high. You see what I'm saying? Like, a lot of things go on in the body that you don't feel. So that's why they do like blood work. Or like yesterday I went to the dentist and I got my teeth checked and then I got a cleaning. My teeth felt fine before I went, but I still went anyway. Actually, I go 3 times a year. Why? Because of bad decisions when I was younger. So a lot of people, it's kind of like, you know, and now I'm really on top of my teeth. For years I've been like that. But a lot of people come in and their spine's rotting. It's kind of like, think about it. If someone comes in to a dentist, they go into a dentist, they have a mouthful of rotten teeth, right? That's not a healthy person. So it's the same thing with the spine. If they have a bunch of degeneration, we can stop that from getting the spine moving properly, but also we can get you out of fight or flight. Okay, so a test that we do with this motion study x-rays is very unique. Most people have never even heard about it before, and you're standing when we do it, so you're loaded. So it's a very functional test, and it's a very vitalistic, holistic approach. All right, so I hope that makes sense. But it was really cool because we had a patient come in yesterday, not really in too much pain, and we get a lot of those. And we also get a lot of questions when I do workshops to adults about babies and kids. So we end up getting a new baby pretty much every week as a new patient, just because, you know, if a baby's dealing with any symptoms, we can get them out of it really quick. All right, so I hope that makes sense, and I will talk to you soon.